Hello and welcome back to Tweet Trends. Today I have a guest with me, and it's my personal back pocket doctor. Whenever I have a question about anything medical, I turn to him, and I know sometimes he's probably like, "I can't believe she's reaching out to me about this again." It's funny to me because I literally do. So if I come up with a question, I reach out to my father-in-law. This is Dr. Jones. I have him on the show with me today. Hey,
Hey, Dad, how are you, dear? And I'm excited to be here.
I'm excited to have you here, and I'm just so tickled because I wonder sometimes when you see my name pop up on your phone, if you're like, "Oh goodness, let me pull out my doctor's hat because she's got some question that
No, the
I
only thing I pull out, the only thing I pull out is my heart to make it larger, and it goes boom, 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 because I love it so much. I enjoy talking with you because it brightens my day.
Awesome. That's so sweet. Oh my goodness. Well, today, because this is cold and flu season, I wanted us to get together and have a little chat about vaccinations and the different things out there that maybe some people aren't thinking about that they should kind of have on their radar. One thing in particular, I know you remind me all the time whenever I'm being extra mental with our daughter and who she gets to hang around and what she gets to do about how many different strains of flu virus there is out there. And
Yes.
so,
Well, it's a difficult thing for parents right now because over the last 4 years, we've heard so much about viruses that maim people, kill them, and alter their lives. So
mhm,
parents want to do the natural thing, which is to protect their children as best they can. And something that didn't happen when you were a child, of course, we didn't have social media. And
true.
when I was a child, we didn't even have paper. They were still chiseling on stone. But but the one of the problems we have with making decisions about our families is the amount of disinformation that you have to sift through.
Mhm,
Okay. So the one thing I'd love for your listeners to know is that they've got to find a trusted source of information around about healthcare, about issues as you and I have established, and uh, and just so your audience will know, you asked me a lot of questions that I don't necessarily know the answer to, but my answer is I'll find out and get right back to you, and that's what you want to have someone in your corner that has the ability to do that. So, in talking about viruses this season, when you're talking about for children, there are a few things that you want to keep in mind. Okay. Viruses protect children by helping to generate antibodies in their system. First of all, we don't have anything that can kill a virus because a virus, unlike a bacteria, when it gets into your body, it gets integrated into your cell. And the
mhm,
only way you can kill that virus is to kill that cell. And you can't live like that. So
right.
we have some so what we do is we help the body's own immune system to fight off that cell, to fight off that virus and not get infected. And the way that works with vaccines is you get a vaccine, your body, it's a mild vaccine, your body recognizes it as something potentially harmful, and it builds its own defenses around it. And it's that antibody defense that leads you to protection down the road. So for parents, please don't let anybody tell you that your children don't need protection from viruses because they do. Now, here's the other thing. Children play with other children and they're in classrooms. And I call those little petri dishes
Mhm,
because petri dish is what you use in school when you want to grow bacteria and virus because they're all getting their exposure to viruses at the same time and at the same time, but different situations. And so when
right.
they come, they're exchanging viruses. So how do we help you to keep your baby and other babies healthy? First of all, check with your doctor or your usual source of care to make sure that your child does not have anything that would prevent them from being able to take their vaccines. They don't
Mhm,
have allergy to certain vaccines are grown on eggs. Some of them are grown in other environments. To make sure that your child does not have something that would preclude their being able to get a vaccine. And if that does not exist, I'd recommend you go with the whole spectrum of vaccines that are available.
Mhm.
There are people, Yvette, that are much smarter than I am, who work all year long on determining what the next year's source of vaccine protections need to look like. Here's an
Okay.
example. Right now in the fall of 2023. Okay,
Right.
it's now but we're in the northern hemisphere of the Earth. In the southern hemisphere, they're in the spring. Okay, so
Mhm.
what we're looking at, we have folks down there looking at what viruses are coming up in the spring and fall down there, and those are being the information from that is being used to guide us on what we can expect the following season. So that's the way it works with flu, and that's the way it works it's going to work with COVID going forward. Now there's no longer a pandemic; it's now an endemic, meaning it's going to be living with us for a long time.
Right.
But I could just talk about this stuff all day. So give me a chance to ask me some questions.
No, well, so it's very interesting because I can recall when, and it's probably still a big thing, but for some reason, when our daughter was very young, the big talk of the anti vaxxer group was just all over the place. And from what I understood, because people were not getting their children vaccinated, that was making the situation worse for everyone.
That is so correct. The goal of vaccinating your children and giving them immunizations is to create something called herd immunity,
Mhm.
HERD immunity. If enough of the people that aggregate together have vaccines and develop immunity, then the likelihood of getting an infection decreases tremendously. It's hard to say you will never get an infection because we're humans and every human body is different.
Right,
However, the likelihood of getting an infection that can seriously harm you or kill you is dramatically decreased. Absent that herd infection, that herd immunity, you, children become at risk for whatever's floating around. So parents who do not vaccinate their children, uh, they may get a much more serious infection from that virus, and then they'll bring it to school. And if other kids haven't developed immunity, they can get that serious component. But if you've got a vaccination, that if you do get an exposure, then the exposure will likely be a great deal less, and your child will go on. And the good thing about children, we just talked about this before we started, children let you know how they're doing.
yes.
If a child is laying around like a lump of coal, your baby is sick. Hug them, love them, and boost them up. But when the minute that baby says, "I want to go out and play," you know that they're better. They're not very good at hiding things. So
Mm-mm.
parents, talk to your clinicians or doctors, and this doesn't matter what flavor of doctor you talk to. It's who you trust to take care of your child and your family. Okay, because there are people that do it differently. And I
Mhm.
always tell folks, when you're informed and engaged, and you've heard me say this to you about taking care of your parents, you're informed and engaged, you're a much better patient and advocate for yourself and for your family.
Mhm.
Then once they do that, treat them if they get a fever, and then let them go play. But there's certain viruses out there that are life threatening, and let's talk about some of those for a moment.
Okay.
One of one of them is the flu, and children uh, can get flu and can get very sick. But more importantly, children can bring flu to other members of the family who might be what's called immunocompromised.
Mhm.
If a 5-year-old or 3-year-old is out playing and they have not had a flu vaccine and they get the flu, it may be very mild on them, but when they come in the house, they may pass it to mom, to dad, and if grandma or grandpa lives there, then they may get it. The problem is grandma and grandpa may be what we call immunocompromised,
Hmm.
or they may have some weaknesses in their internal defense system, and it can kill them.
Right.
Okay. There's something else about the flu vaccine. If someone is older and they have heart disease, there's some things about the flu vaccine that are called cardioprotective, meaning they help to protect your heart from having severe outcomes with a flu infection. Okay,
Hmm.
so not only do you help decrease the likelihood of the flu, but you also decrease the heart-related bad outcomes because of the cardioprotective nature of the flu vaccine.
Right.
Okay, and um, I got to make you laugh. I did the military for 28 and a half years. And many times in the military, I didn't get a flu shot because sometimes I'd get a reaction. The minute I
Hmm.
got out of the military, I said, I haven't been doing it all these years. The very next year, I got the flu and had to be hospitalized with a flu generated pneumonia. And I have not failed to
Wow.
get the flu since that. And that's been 22 years. Okay. So it's serious if you're an adult and if you're an older adult. Okay. So the children can be protected and they can help protect the rest of the family. You know.
Well, and so I was going to ask about that because I've heard a lot of people say that they don't take the flu vaccine because every time they take it, they end up catching the flu. But I know from talking to you that the vaccine that they took may have covered a different strand of the flu than the one that they got. Therefore, they were still susceptible to getting the flu, just not that one. I
And
listen.
that's a point someone made. Yeah, I'm going to pat you on your back since you can't reach your own back. It's interesting. Um, the flu vaccine that we derive for the season many times is only 60% effective against all of the potential flu strains out there. But if I've got 60% protection as opposed to 0% protection, I'll take 60 any day. Okay.
Yes.
But if you don't get the flu shot, you've got 0% protection. Okay.
There are worse odds on the lottery, and people will play that quicker than they'll go get a vaccination. So I recommend the same. Go ahead. You got better chances to not get the flu
That's
if you get the vaccine than what you have on winning the lottery.
There you go. There you go. But the important thing about what you're saying is that um, even if you get the vaccine and you get a viral set of symptoms, they're not nearly as bad. So you can go
Mhm.
ahead and live with that and treat yourself with Tylenol, because or something like that, and then treat your symptoms of cough and runny nose. The main thing I'd advise you to do is drink lots of liquids and try to stay away from other members of the family and wash your hands as much
Mhm.
as possible. Try to cough into your armpit and to cut or cover your face. And there are lots of things that can help, especially to keep families healthy and happy at this time. But there are a couple of vaccines that I want to talk with you about that are really controversial for
Mm.
some families
Okay.
as they look at children's age. We know that we get the measles, mumps, and rubella. Kids have to have that to go to school.
Mhm.
Um, there was a time when you only got that once in your career and your educational career, and you didn't get it anymore. But in the 1990s, I was a part of a research effort that demonstrated that you had decreasing immunity over time and that you needed an MMR booster while
Mhm.
you were in high school. Now that MMR booster is required before you go to college. Okay.
Okay.
Because what we found was people were getting measles, mumps, and rubella, or the measles in the military and in college, and it was making them deadly sick. So you get the MMR series when you're a child, young child, and then
Mhm.
you get a booster around your high school age. That's critically important, and it helps to keep you from getting that. An adult with the mumps or measles can have serious, serious bad outcomes. Okay, so you want to protect for that. There's another called tetanus, previously called lockjaw. Okay,
I
that's what
was
we called
just
it in.
asked about this one the other day. The lady asked me if and I'm like, you know what? I'm gonna say no because I can't say the last time I got a shot. But yeah, she mentioned tetanus. So tell me, please, what do I need to
You
know? Do
should
I
get
need to go back? No, they didn't offer it. They
it.
didn't say, well, you want to get it while you're here? No, they just asked if I had it and kept it moving.
If that is if that's the situation one of your listeners is in, would be find themselves in, I'd recommend that they say, I don't remember when I've had it, but for protection, let me go ahead and get one now. Okay, because getting a second one will not hurt you, but you should get them every 10 years. Okay.
Hmm.
And what happens is if you get a puncture wound, like you step on a nail, or you're swimming and you get a cut in your skin, the bacteria that can get in there is it can lead to tetanus or diphtheria, and those are the kinds of things that can lead to problems for you. Okay, so that's why I would always tell my family members if you're not sure whether you've had a tetanus shot or not, get it. The reason I
Hmm.
used to call lockjaw is because people would get these really high fevers, and they would shiver so much that their jaws would clench, and so, we didn't know the science, but we knew what we saw. So
Right.
we said, "Oh my God, you got the lockjaw." So we got to prevent that. So that's what the tetanus leads to, prevention of that. But there's a one that's really kind of controversial, especially in communities of color, and it's called human papillomavirus, or HPV.
Hmm.
Okay, we studied for a long time, we being scientists much brighter than I am, tried to figure out what led to cervical cancer in women, cancer of the cervix. And they began to find out about 25 years ago that cancer of the cervix was caused by a virus that led to changes that went on to become cancer. About 15 years ago, they found out, or 20 years ago, 15 now, about 15 years ago, they found out that, wait a minute, we have now found the particular virus, the strand of virus that can cause that. It is a part of the human papillomavirus family. So it's recommended that for boys and girls in adolescence, that you get this vaccine. I guess you say, why boys too, if it's
Hmm.
cervical cancer? Okay. The reason it's boys too is because uh, if a boy has sex and does not have a condom, he can get the virus into his skin. And then if he has sex with another person without using a condom, he can transfer the virus onto a woman or a female, and who could be at risk of getting cervical cancer. And it doesn't show up right away. It takes time. And if you don't get your regular checkups and things of that nature, then you may miss the opportunity to find it before it leads to cervical cancer. Um, when my youngest daughter, who's now 21, got to that 13-year-old part at that, now it's down between 10 and 12, they're asking.
Hmm.
Um, went through all of the literature, and it was still 10 years ago, so the literature wasn't as clearly defined as it is today. And I said to my wife, we just need to do this to protect her. And families, here's why. If your daughter or granddaughter or niece or nephew, excuse me, or niece, happens to be molested by someone who has this virus, then they could later end up developing cancer, cervical cancer. It's a protection for them against voluntary activities leading to a bad outcome, and involuntary or
Involuntary.
violent. Okay, so that's why it's critically important. And it goes back to the herd protection we talked about. You remember we talked about the HERD protection? If
Hmm.
we've got the herd in which our children functioning protected by this vaccine, then we need not worry about it being something that would be life-threatening for them. Okay.
Right.
Um, so if someone would take now to call. I lost my train of thought, so ask me another question.
Well, no, so I'm glad you touched on that because that was one that I didn't grow up with. Like, you hear about measles, mumps, rubella, the flu, all of these other ones. They all sound real familiar, but that was one that is kind of like Okay, what is this about? And the question of why boys and girls, when you actually hear like what it's preventing, so that all makes complete sense. And then the added piece on there where you mention about any type of involuntary activity that may take place, that's still another layer of protection. So that's that's great right there. That's great to know and to be able to process that when it's time, because you go into the doctor's office with your kids and they ask you, what do you think? Do you want to do this? And if you don't go in there educated, knowing what, your kid is going to tell you, no, I don't want a shot. No, don't do it. They're going to be the person against doing the shots. But if you go in there with the knowledge of what it is, why it is, then you can make better decisions on the spot, because a lot of times you don't know ahead of time what's coming up. Sometimes the doctors have told us, okay, on her next checkup, these will be the shots that she'll need to take or whatever. But we're at that place now where there was a little gap in between. So it's been a couple of years, seems like, that she hasn't had to have anything other than flu and COVID boosters. And so
Yes.
now we're rolling into that HPV era. And it's kind
Yeah.
of like, okay.
It's you need to know. But let me share this with you. There are multiple strands of human papillomavirus. Okay,
Mm,
not all of them lead to cancer.
okay.
Okay, a cervical cancer. There are some people who may get a human papillomavirus infection, male or female, and they'll get gigantic wart-looking things, W-A-R-T, looking lesions on their body. But those are not the viral warts that lead to cancer. The very specific, we found the specific types, and they have numbers. And the viruses with those uh, type numbers are those that are protected by this vaccine. So, so if my key thing is, if anyone is having any kind of sexual contact that is other than with a long-standing regular partner, if there's anything else that's added into the circle, either protect yourself with a condom as a male or a female condom, or or avoid the opportunity if it presents itself, and then make sure that your vaccinations are up to date, because I'm willing to bet that in a few years we're going to find that there's some cancerous changes that are coming about in men too from this virus. We just haven't discovered those yet. And no,
Right.
I'm not wishing bad on anyone, but I'm just saying that's kind of how it goes. It shows
Right.
up in women first because your bodies are a great deal more sensitive than
Hmm.
men. In the bed down the road, we may end up finding that there's certain cancerous type lesions that men get on their genital parts that will be traceable back to this virus. But it's the fun part about being a human in today's world. But
Oh, fun, fun.
I,
Yes.
I do want to
Figuring
talk to
out
you also,
this whole Russian roulette of diseases that you can get. Oh yeah, fun,
but
fun.
just so your audience know, I'm a firm believer in this. I've written a couple of lengthy articles for physicians that have been published on, for instance, how to manage influenza in the era of COVID,
Mm,
and it's been cited multiple times. And I have a new uh, physicians magazine supplement coming out for November that's giving instructions on how to make sure that patients in underserved populations know how to test for both flu and COVID, and how to make sure that they get the protections they need, and to make sure that they get their vaccines. So that's critically important. And the reason why I endeavored on these is because communities of color have had more deaths from both of those infections than any other
mm,
communities. People still die from flu related illnesses. And then when COVID came out, it really hit the African American and Latino populations very, very hard. So we have to protect ourselves. Now, way back when COVID first hit, and folks were saying, well, we're going to get out of this and it'll go away. I said, no, folks, we're going to be dealing with COVID the rest of our lives because it was a new type of virus.
Mhm.
100 years earlier, we had influenza that came and killed as many more people than COVID did worldwide.
Mhm.
Okay, or as many. And now here it is 100 years later, we're still treating influenza. So I need folks to know, don't say, I've had enough COVID shots, I don't want any more. Protect yourself against emerging strands. Viruses are very geniusly uh, contrived or combined. They find weaknesses in the host that they want to attack. And if they can find one virus migration that goes in, it goes and populates all of the other viruses and it amplifies. And now you've got susceptibility to that one. So please protect yourself. Uh, I think we're going to reach the point that we're going to get an annual COVID vaccine added to the remedy, just as we get an annual flu vaccine.
So
And
that
there's some,
was that was going to be my question to you. Is there uh what's the period of COVID vaccine to, because right now I feel like I'm just kind of like rolling the dice, like, yeah, I feel like it's about that time. I think I should probably
well,
go get vaccinated again, get a booster, you know.
yeah, but that's why you need to have your regular sense of care, your doc that is aware of what's going on in the community.
Hmm.
Okay, your doc could be an MD or a DO or even a doctor of nursing practice, DNP. Okay,
Hmm.
somebody that has has an awareness and stays abreast of what's coming out of the Centers for Disease Control and out of the research communities to let you know what's going on, what's going around our community now, and what do we need to protect for. And I think that would always help you. The reason why I say that we're going to get to the point potentially, in my opinion, of having it be a seasonal dose, like we do with influenza, is that we've learned so much about COVID in the last 4 years. To
Hmm.
go from something that was barely on our radar to something that killed hundreds of thousands of people, and now we're finding a way to make it a chronic illness or something to protect for. So we've come a long way, and scientists are still studying. I will
Right.
say to your listeners, believe the science. Don't listen to the people who are science deniers. Believe the science. Follow the science and follow the recommendation of your doctors. And I pray that we get to the point of it being a seasonal vaccine that we can protect ourselves. I got to tell you one other thing before I forget. Some of the people that I talk to say, wait a minute, why do we have to get all these vaccines? And I remind them, science has come to the point that we now know why people die. In your lifetime, Yvette, you probably heard someone say, oh, that person died of natural causes,
Hmm.
right? And in your parents' lifetime, they'll say cause of death undetermined, therefore natural causes. Well, there are
Hmm.
very few occasions that happen now because science has evolved to the point that we can find out the an overwhelmingly high number of causes of death. And what science has also done is say, we know these things kill you, so how can we prevent them? We can prevent them with vaccines. That's why you're getting more vaccines. If we want to live to get our, what is it, 4 score and 10, if we want to live longer than that, or as long as we were prescribed to live in the Bible, getting your vaccines on a regular basis as advised by your doctor or health professional is the way to help to make sure you do it. I'm 75 years old and I'm still acting like I'm 18. Of course, I don't look it, but I still think I'm 18, and I want to live another 75 years.
Well, so question then, how do you convince people in minority communities that it's okay to trust the scientists, the doctors, when you have situations in the past where unethical things have taken place? How do you then convince people that have passed down story from generation to generation, like you don't trust doctors, you don't, you don't even go to the hospital because people don't come out, you go in And how do you get beyond that?
Yvette, you must have been listening to the talk that I gave in New Orleans last Friday. Okay. I
Yes,
gave,
I was
I
there.
touched, I touched on, it was an environmental talk, and we talked about how things are changing in the environment and why we've got to trust getting the health care. For your listeners who may not know, uh, most of the distrust by people of color uh, stems from the Tuskegee experiment for syphilis, where some nearly 400 men were known to have syphilis and were not treated because they wanted to follow the course of the disease. Well, it was supposed to go on for 2 years. And in exchange for participation, these sharecroppers, uneducated people, were given free health care, which was suboptimal. And if they died, their family wouldn't have to pay for their burial. Well, this went on for 40 years before it was finally discovered, and the unethical nature of that was addressed. Um, I, you know, I've been the president of a national medical group called the American Academy of Family Physicians. I was blessed to be their first Black president. And so I leveraged that relationship to be involved with the scientists. And what we've done and what science has done is created protections for human subjects. So now you cannot be subjected to what happened to those men and women in with that syphilis experiment. The reason I say men and women is because a large number of women ended up getting syphilis infections, and their babies were born with congenital syphilis. Okay, so now we've got protections against that, and they're there. The second thing is that as a woman, even before the Tuskegee study, there was a man named Dr. Sims who was considered the father of GYN, and what he did was he did horrendous surgeries on female slaves because he wanted to prove that that slave women felt pain differently than white women did.
Mhm.
And so he would operate on their genitals and without any anesthesia to demonstrate that Black women had a higher tolerance of pain. And he was lauded as the father of gynecologic surgeries because he developed these approaches, but he did it at the expense of Black families. Um, I need to share with your listeners, my family got our health care in the charity hospital system of New Orleans. We heard the stories about if the white coats come to get you and take you to charity, you may not come back out again. Well, those that didn't come out were those that were had such severely advanced medical issues that there was
Right.
no way to meaningfully treat them. So if we get the care right away, then we won't be in that situation. Lastly, I spend a lot of time working with doctors to make them know about something called culturally and linguistically appropriate services class, CLAS. That means you have to understand the environment of where patients come from. You have to understand what things mean in their language. You have to make sure that your interaction with them is appropriate. And this needs to cover the full range of services. I know of a family member who for many years complained about a misery in the side. And I couldn't see anything. So I had him to see a physician friend of mine who sat down and took a long history from and sent that family member off to get a CAT scan, and they were found to have a fungating cancer on their kidney. There's no substitute for finding doctors that will listen to you and understand what you say. I was taught way back in the 70s that if you listen to your patients, they will tell you what's wrong. Okay. But you got to find doctors who will listen to you. I'm going to advocate for my daughter in a different city next week because her doctors are not listening. So I'm going to go there and make sure that they listen. So you got to trust your doctors. And if they're not listening, find someone to advocate with you and for you. And that's how we stay healthy. But don't run away from vaccines. Don't run away from healthcare. That's the easiest way to make sure that They won't. The Association of Black Cardiologists used to have a slogan that said, "Children should know their grandparents." That would be the easiest way to make sure that your children don't know their grandparents by not getting them the care that they deserve and need. So my hope for you and the excellent job of you do of communicating with your audience, I just want to say to you that uh, encourage them to get health care regularly. Encourage them to ask the difficult questions. Encourage them to make a note long before they go to the doctor of all the things they want to talk about. Bring your laundry list of things in. And what your doctor ought to do is say, well, I can't cover all of those today, but let's deal with this, this, and this today. And then we'll come back for the next visit and we'll deal with these. And let's always leave with a plan of how we're going to have care. And then your listeners have to follow up on that plan from their perspective. Doctors can't cure you, they can help you in curing yourself.
I can't find a better way to put a bow on this episode. That's perfect. Personally, I have a binder that I take with me to the doctor so that I can keep up with the questions that I've asked, the ones that I got answers to, and the ones that I didn't, that I still want answers to, that sort of thing. So, yes, definitely advocating for yourself. And if you're afraid or can't do it, then to get somebody else in on it with you as well. And especially for those of us with elderly parents, I have a mother who is not the best patient by any stretch of the imagination. And so we
But
found that
I'm gonna
it's necessary for somebody to go along with her to these appointments. One, because she doesn't understand a lot of the things that the doctors are saying if they don't put it in plain language. If they're using too many technical terms, she hears it and doesn't hear it. And, so even in those situations where you may think somebody is fine because they're big enough, grown enough, old enough to drive themselves to the doctor's office, if they will allow you to go with them, I think that is a definite plus to have two sets of ears listening and being able to chime in. So, thank you so much. We're going to try to do this more often with some other health topics to get it out there, to get people the correct information, and to not be so afraid of whatever they might be afraid of at the doctor's office. That's probably a whole nother subject as far
Yes, it is.
as people getting a diagnosis like, oh, I'd rather just not know. No, please. Please find out, because there could be a very simple solution, but you gotta let somebody know what's going on.
And as a doctor, it's a great joy for me to, in my career, to have worked with a family that is a motivated, informed, educated family. And I don't mean necessarily having a terminal degree. I mean educated about your body, about your health, about your family's history. If a doctor doesn't have the time and doesn't enjoy that interaction with you, then that's not the right doctor for you. Okay. If they say, oh, here comes Yvette with her laundry list, that's not the right doctor for you.
I'm sure that's the conversation in the halls after I leave. Like, oh, how many questions does she have today? Oh, she only had 20 today. Only 20. It was a good day. We
thank,
got in and out.
thank you so much, Yvette, for the chance to be with you and your audience today. Thank you.
Oh, no problem. Thank you so much for taking the time out of your schedule to share those gems with everyone. And hopefully they're taking notes. And if not, they can always just rewind it and listen to it again. I say rewind as if this is a tape. They'll just hit the button. Just play again. Oh, goodness.
Oh,
All right. So I look forward to our next conversation.
thank you, dear. Have a wonderful day.
You too.